Here at the Ready State, we take a systems approach to complex movement behavior. But what does that mean? It means that when we're asking how can we improve a movement system or change a movement behavior, we need to be thinking and how these big blocks interact. So specifically, one of the things we might ask is, hey, is this an environmental problem? Is this something going on with sleep or stress that's leading the brain to become more sensitive, or we're engaging in certain behaviors that are making other behaviors more difficult? I do a ton of sitting and then it's harder to extend my hip. Do I need to change some aspect of my environment? We might also ask, hey, is this a movement problem? Boy, that's easy to sort of solve. Hey, is there a technique issue going on? Hey, does the person know how to actually use their body in the way that expresses better motor function, right? That's why we teach technique. We teach to the highest expression of the movement. But we can also start to ask, well, what else is going on? Do we think this is a joint capsule problem? Could we mobilize something that looks more like the joint capsule? Is it a sliding surface problem? Do we have just good old-fashioned sticky, sort of matted down tissues that don't articulate very well? So, hey, maybe we need to do some myofascial work or sort of superficial mobilization of the tissues. We need to get nerves running through nerve tunnels here. And then lastly, do we think that this is sort of a muscle restriction problem? And that can be multiple things. That could be, hey, the brain is not giving me access to this position. But also we work with a lot of big, powerful athletes who are what we call stiff. And oftentimes, just by restoring one aspect of this system, we start to see changes in the whole system. There's a lot to unpack here. Of course, I'm going to talk about your environment and what's going on, your sleep, nutrition, how you move, and then these different various systems. It's probably difficult to work on just the joint capsule without impacting other things, and likewise. But remember that as we're starting to work through the reason why someone has pain or can't do something, we're always taking a systems approach.